Hello, everybody. Welcome to another episode of Occupational Therapy for Life. Today, we're going to wrap up our occupational therapy framework and domain process. This is the fourth edition that we're discussing. Don't forget to like and subscribe. I just wanted to say that I had a couple of things happening, so I wasn't able to post as frequently as I wanted to post. So just in case you thought I was like just checking out or something. But yeah, so I'm back. So disclaimer, it's for entertainment purposes. And if you have any emergencies, always call 911. If you have any concern with your health, always seek the guidance of your primary care provider. They know more about you and can also help alleviate any concerns or anxiety you may have about the welfare of your body. All right, so we talked about domain. Domain has pretty much 5 parts. It has occupation, contacts, performance patterns, performance skills, and client factors. And we're wrapping up the process part. The process, domain is like the areas we're working at. Process is the how-to. So in a section of process, we have evaluation, we have intervention, and outcome. So today we're going to be looking at intervention and outcome. Intervention is basically how you're going to go about helping this person to achieve the desired outcome that you and that client both agreed on. I said agreed on because when we are evaluating and putting patients on program, we are interviewing them, we're observing them, we're talking to families, we're getting information, and we also want to find out what's important to them and why that's important and how we can go about helping them to achieve the desired outcome. Now, intervention is important because it basically it's a way to find out what we can do to help. So a lot of our approaches to providing therapeutic intervention is usually supported by evidence-based. Evidence-based is like, okay, this has worked under these conditions. These are the type of clientels or people with these conditions that this may work with. Or pretty much, if you try doing this exercise, you may not get the desired outcome, but if you only do it twice, versus if you do this particular exercise 4 times, you get a desired outcome. Or here's what to look for. So intervention is usually driven by evidence-based. Evidence-based is like research that has been done. And so we are using those. And to find out what's the most current, because some of the time you may have certain approaches that's no longer applicable, or we don't use that anymore. So, and then an intervention also gives us an idea of where we're starting and where we want to go. That's pretty much it. Intervention usually focus on specific occupation, because there's a lot of occupation we can focus on. This occupation falls in the domain area, and you can't work on all of them. So you have to find out what's important and what's necessary, what's priority, and where this person is in their stages of their life, and what is the most vital thing that has to be done. And you also, through the intervention and evaluation process, you also let the patient know whether you can help them or not. Or maybe you may say, I can't help you from an occupational therapy standpoint, but I could refer you to this discipline or this specialist that may be able to help you. All right. So now outcome is like, what do we want to get? So usually outcome helps you to compare how, when you first evaluate a patient, where you found them, you should be able to see a difference where they are. So throughout the evaluation, intervention, and outcome process, we're looking to see if person is getting close to their goals. So usually in a skilled nursing facility, we have every 2 weeks or every 10-day progress note that we submit to the insurance company to show them if this person is making progress in the goals or if they're not. And then in the schools, the IEPs is usually You can measure every quarterly, every 3 months, so depending on how they set it up. But usually we have an IEP meeting yearly for each student, and we're going to see if they're meeting the goals, if they're not meeting the goals, why, and what can we do to help the students meet their goals. So outcome is basically, what is the expected outcome? So even when you're evaluating the patient, you already have in your mind the outcomes that you want to get and how you're going to get it. So that's something that sometimes the client is not privy to, but we as professionals are already thinking about those things. So that's pretty much it. So that pretty much wraps up occupational therapy framework, domain, and process. It's more detailed than that, but like I said, it's like a manual for occupational therapists. It's like a blueprint. It guides us and it helps us to keep certain things in mind when we're dealing with patients. Now, this is very broad. It's not something that is like, here's what to do when somebody breaks their arm. Because somebody could break their arm, they could have a shoulder replacement, they could have nails and pins put in, or the doctor, surgeon might say, oh, just leave it alone. So all those do require different approaches, and all those is steps to like when we can implement exercise or range of motion, which is basically stretching. So everything has a certain protocol you have to follow. And so that's pretty much it for now. Thank you for your support, everybody, and look forward to the next episode. Have a good day. Oh, if you see the lighting change, because I use the sun as my natural light, so it changes. All right, everyone, have a good day. Bye-bye.